My name is Valerie Repka, and I am a member of the WADEM Nursing Special Interest Group, as well as a member of the Board of Directors. I'd like to welcome everyone to the latest edition of the WADEM Nursing Special Interest Group's webinar series. And I'd like to begin with land acknowledgement. I live in Toronto, Ontario, Canada, and I wish to acknowledge that I work, live, and play on the traditional territories of the Mississauga of the Credit First Nation, Anishinaabe, Haudenosaunee, Wendat, and Huron Indigenous peoples, and offer my sincere gratitude to them as the original nations of this land, guided by the dish with one spoon wampum. This territory lies within the lands covered by the Upper Canada Treaties, and it continues to be home to many First Nations, Métis, and Inuit peoples from across Turtle Island. Today's webinar will feature two talks, East Meets West, Transcending Disaster Nursing Amidst Turbulence, presented by Jamla Rizek, and Code Red to Code Ready, where our Malaysian nurses on disaster preparedness, presented by Nurul'Ain Ahayalimudin. There will be time for discussion after the presentations. Please submit your questions using the Q&A tab in the Zoom. And now to introduce today's presenters. Dr. Nurul'Ain Ahayalimudin is an assistant professor at the Kuliah School of Nursing, International Islamic University, Malaysia, specializing in emergency and disaster nursing. Her research focuses on disaster preparedness, augmented reality, simulation, and the integration of artificial intelligence, AI, in clinical decision-making and triage systems. She has secured competitive national grants, published widely, and presented at numerous international conferences. Dr. Nurul'Ain also holds leadership roles within the Malaysian Nurses Association and the World Society of Disaster Nursing, where she champions innovation and capacity building in disaster health and nursing education. Jamla Rizek is a decorated emergency and disaster nurse, international speaker, and active duty nurse officer with over 15 years of frontline experience. She has responded to some of the world's most complex public health crises and disasters, bringing a global perspective on resilience, response, and recovery, especially among vulnerable and underserved communities. I'd like to invite Jamla to begin her presentation and welcome any questions in the Q&A section of the Zoom, which is found right below here.
Thanks,
Thank you,
Valerie.
Jamla.
Thanks, Valerie. Good morning, everyone. Good afternoon and good evening. Today's presentation on West Meets East is going to be the ideal way for us as nurses to think about how we respond to disasters. I do want to disclose from the beginning that this is a presentation that I am presenting on in my own capacity. The other thing that I will share is that I will be posting links in the chat at the end of this presentation. So all of the links that are hyperlinked that I will mention, I'll share later on. So in the turn of top types of disasters, it's still early Monday, I really want to focus on a couple of things, most importantly, the term natural disasters. And I say this to you because we really have to get away from the term natural disaster, because natural disasters aren't really a thing. It could be because we are not prepared, we are not focusing on the type of issues at hand, but really we need to change the term natural disaster. The other things that I will focus on during this presentation are going to be mass shootings, chemical spills, and cyber attacks. And I think it's extremely important for us as nurses, wherever you are, to focus on how we can make that change. And you can see that on the picture on the right-hand side. So if just one person makes that change as far as calling things natural disasters, we can change the world. So why disaster nursing matters more than ever. In this slide here, you can see all the different types of disasters that are all over the world. I purposely focused on a geographical map, not just the United States, because we have a lot more things that we have in common than we have that are not. So for example, we are just as impacted by floods, landslides, and storms here in the United States as some parts of the other country. Now, as a nurse, I share that with you all so that we can learn from each other. If you may not have been impacted by one of these disasters, that doesn't mean that it's not going to happen. It means that we can learn from our sisters and our brothers from our other countries and learn their mitigation and preparedness strategies. Understand from them how they responded to the disaster. Perhaps there's some lessons learned that we can take and then apply it to where we work, whether we are in a rural area or whether we are in a facility that has all the bells and whistles available to us. So emergency declarations and infrastructure. I want to just take a couple of minutes just to focus on this in terms of how how disasters here in the United States are classified, for example. Just because there's a landslide doesn't mean that there is going to be an emergency declaration. Just because there's a tornado or a great impact from a hurricane doesn't mean that all of a sudden resources are going to go right to that area. In fact, there's a lot of things that are important right now, especially as we talk about political changes. And so though this is not a political presentation, it is important to understand how that does impact disaster response. So what happens initially is that an emergency declaration has to be declared, and the local state government has to say, you know what, with all the resources that we have, we're not prepared, or we don't have enough for us to go ahead and care for our community members. And so then that goes up the chain following incident command all the way up to our federal government, who will then activate the resources that are needed for that type of disaster. One of the things that I do want to stress is the term interoperability and scalability. We have to work with our other partners, whether they're local EMS agencies, local hospitals as well, so that if we did have to, for example, evacuate one of the rural hospitals as a result of a disaster, do we have that partnership with another hospital that then would take those patients and provide that level of care? It's extremely important that we talk about this on a daily basis, update our plans, and ensure that those conversations are still ongoing so that when that disaster does strike, we are prepared. And this link I will share, it tells you all the disasters that are currently happening, not just in the United States, but throughout the world that have federal declarations. Some of the other things as we talk about disaster response is thinking about the different resources. So as somebody who has responded all over the world, it's important to understand what type of tools are available and kind of adapt to that. So here in the United States, for example, during disasters, we use START and jumpstart triage. However, in Global South and Asia, in the MENA regions, which are the Middle East and North African regions, they rely on the WHO EMT guidelines. But somebody from the United States, perhaps who is not familiar with those types of guidelines, may not even know about it. And so as we talk about the impact that nurses can make, we really have to think of what are some barriers and challenges that we have to overcome. The other thing that I want to focus on is that PPE distribution. So that last slide, that last table on the left. So here in the United States, there is a supply chain issue. So depending on where we get our supplies from, whether it's a big sister hospital, whether it's the federal government, we have to make sure that we're prepared and we have enough in stock for that next disaster. However, if we have so much prepared stuff, what happens if they expire or we don't check those supplies anytime soon and then they just expire and we waste all of that? So just some things to consider as well. But in the global area, we're thinking about the NGO, and they are the ones that lead the supply chains. So a lot of the infrastructure does not have the opportunity for PPE distribution, and so they rely on others to bring in those supplies that are needed, not just for the responders, but also for the individuals in the community. Another thing I want to stress here is that community engagement is extremely important, especially as it pertains to village elders and religious leaders. Local mosques, churches, we need to engage those elders and those religious leaders in regard to preparing their people for disasters. Because if we don't engage them early on, we're not going to be able to build that trust. Some modern threats to public health. I mentioned this briefly, the mass shootings and the chemical spills, but let's focus right now just on the picture in the top right-hand corner. This is a train derailment in East Palestine, Ohio. Now, if you look at it, it looks like there's a fire. You can see that it's kind of a rural area, but some of the things that I want you guys to think of is this One Health approach to disasters. I'll go more in depth than that in just a few slides, but it's not just this acute impact, this initial insult, this initial disaster that happened. There's actually more that we have to prepare for as far as chronic health issues, as far as the whole global impact of this train being derailed. This picture on the bottom right-hand corner of your screen has the mass shooting tracker site. And I just put it for the United States. And I just want to give a little disclosure here. There is a difference in regard to mass shootings as it pertains to one individual, more than one individual, etc. So for the purposes of this presentation, I didn't go more in depth, but these are interactive sites that you'll have access to, and you can actually put in the criteria in the left-hand corner, and then you can see just even in your own area. What's really interesting for me is that a lot of the information that I was able to pull from these sites is not really information that you see on the news. So a lot of shootings, you don't actually know that are happening, and some of this is happening right in our backyards, unfortunately. So when we think again about the long-term exposures of chemical spills, long-term exposures of wildfires, again, we think of the direct or the acute health impacts, but we don't necessarily think of those long-term implications. And you can see that on the bottom left-hand corner of your screen, the psychological effects, and then the pollution and the contamination. So if you think about it, look at the destruction in this picture, right on the top left-hand or right-hand corner, excuse me, this one right here, that whole area is completely decimated. And so think of the smoke, the inhalation injuries. Think of the impact of that smoke to our soil, our water sites, or our animals. The animals that go ahead and feed off of the earth that we then eat. And what are the long-term effects does that have on us? The other thing I love to share is, again, that term interoperability. And I want to draw your attention to some of these pictures in the bottom right-hand corner. So you should be able to see it's kind of this the sheriff's vehicle, and you can see that people are being evacuated from a facility into the sheriff's vehicle or the police vehicles. And this is where that interoperability comes in that I mentioned. So if you did have to evacuate a hospital with patients that are semi-mobile, what are some alternate sites that you could take them to, and who's going to be able to transport them? What does that mode of transportation look like? Do you even have ambulances that are enough to carry all of these individuals? What about if it's somebody like the bottom right-hand corner where there's multiple patients or multiple people that are needed just to evacuate one patient? Is it going to take up all of your resources? Where is this patient going to go? How are they going to get there? Do you have enough supplies, medications to get that patient safely from point A to point B? Is bringing that patient out of that hospital with all of that smoke in the background, is that going to make their issue more complex? Is it going to harm them more? So just some things to consider. Cyber attacks here in the United States are a huge issue. That's actually a lie. It's not just here in the United States, it's all over the world, but we see a lot of the complications to having a ransomware or a cyber attack. And I think a lot of it has to do with the fact that we in the United States rely a lot on technology. So whether they're pacemakers or whether we have the monitoring devices in the hospital that automatically cycle the patient's blood pressure and vital signs and input them into the computer system. I mean, I take that stuff for granted. It's so easy, right? I just cycle my patient's blood pressure and automatically it goes to the computer system. However, what happens if there is a cyber attack and those resources are not available? Or what if there are some egregious numbers and then we end up doing something to a patient based off of those numbers that aren't really real? The other thing that we have to think of is, what if we don't have access to patients' records? When I started out in nursing, we had paper records, but now everything is electronic. So if we don't have access to any of those documents, how do we safely, if a person is not able to communicate with us, provide that care to them, not do something that is more harmful if we don't have access to those records? Just some things to consider. And again, this is a live threat map. You'll have access to this, as I mentioned, and it's really interesting to see the types of attacks that are happening and where they are and as far as the process. So another thing that I thought was really interesting was that the top attackers are people in the United States, and the top country that is attacked is first Switzerland, but then second, the United States. So very interesting, I thought. Let's focus a little bit on the flooding and the waterborne illnesses, some displacement, some sheltering. So I want to focus your attention to this picture right over here. And this is the subway station in New York City. And you can see that the fire department is there and the water is so high. That is not a fake picture. That is something that actually really did happen back in 2021 during Hurricane Ida, excuse me. And so if the primary mode of transportation has to do with subway or metro center, and that is no longer an option, we then have individuals like this in the top right-hand corner that is walking to work, for example. The challenge becomes, look what's in that water. Do you even know? I see a trash can to the left of that individual. Who knows what types of infections or diseases are, swimming literally in this water. The other thing, as a first responder, as a nationally registered paramedic, if I had to transport a patient to the hospital, if I was in this ambulance, is my equipment still going to work? Is it going to give me erroneous data if I'm transporting that patient and hooking them up to the monitor? Or is this even going to function? Am I even going to be able to take this ambulance, or is it just going to shut down? Because you can see the level of water. Now, these pictures of the feet actually have to do with Hurricane Maria deployment that I went to in Puerto Rico. And the picture on the left has to do with a gentleman that literally walked to our shelter to get care. He did actually have sandals on, but even with the sandals, there was just so much water that his feet was just breaking down. And that's actually a good picture. Some of the other ones were pretty nasty. And then this picture here of the little girl in the center of the screen is actually a little girl who was playing outside. And this is just the impact of the water and the debris on her. Now, again, we don't know if there's a disease that's being spread as a result of what's, swimming in the water, as I mentioned, but these are just some of the things that us as nurses, we have to think about. The other thing I want to stress is that there is no health without mental health. So there is the invisible wound, we call it. And these are the things that we just don't talk about. And you can see the picture on the left from the WHO, and they're pulling this, they're pulling the thread, they're spooling the thread, right? And so as that thread becomes less and less, what happens to that individual? The picture on the right is actually a real picture. It says everything will be all right. And it's something that kids drew with chalk during one of the disasters. And I say this to you because as a first responder, as nurses, we see so much, but it's just as equally important that we are getting the help that we need for the disasters that are happening, because otherwise we're not going to be able to care for others. There is this stigma as far as nurses or first responders needing mental health. And I would argue that we should incorporate that right from the beginning into everything, because the sooner we can address the issues and talk about them, the better that we're going to be able to be in caring and understanding our patients. Social media is great to an extent. The picture on the left of the Twin Towers, that is a picture that was constantly shown on the screen after the planes hit the World Trade Center. There's a pediatric patient that parents brought them in a catatonic state when I was in New York. And he came in with his parents, as I mentioned, and he was very much just unable to communicate. And the reason why was because he thought that the the constant re-images of the planes hitting the towers was happening every single time he saw it on the TV screen. He didn't understand that they were just replaying something that had happened. And that's what scared him and put him in this catatonic state. The other thing I want to stress is, kids are not immune to what's happening in the world. You can see the different types of social media, but we don't know who's on the other side of that. Kids can be trafficked, kids can be given misinformation, kids can be led to do things that are more harm to themselves or to others. And that's why NBC Nightly News created this kids edition. So what they did was they took the top headlines of what was happening in the world and they broke it down in a way that kids could understand. Now, mind you, this is not every topic that's happening, but it's also a way for the kids to say, okay, this is happening. How does this affect me? Or how do I take this information and understand it in a way that affects me every day and my family? So that's an incredible tool. I briefly mentioned infectious diseases. Some of the things that we see a lot of is dengue. We do see a lot of other mosquito-borne illnesses. And this is why it's important for us as nurses to prepare on how we would treat patients if we had to care for them. And you can see here I am trying to go ahead and assess the patient with gloves on. I'm in full PPE, but it's still very, very hot. It's still very uncomfortable, and it's very challenging for me to be able to provide care for this patient. And this was in a practice setting. I did have the opportunity to do this in a real life setting, and it was just as challenging. And these, again, just some headlines that I mentioned as far as the dengue crisis. But I want to draw your attention to the bottom left-hand corner of the screen and really just the stress of, we here in the United States are not prepared, regardless of how prepared we think we are. And it's because we think we are prepared. Now, I know it seems like I'm just saying the same thing, but hear me out for a second. If I tell you that I'm prepared for a mosquito-borne illness, what does that mean? And am I going to need the same supplies or equipment for one mosquito-borne illness that I would need for the other? Probably. I will need more. I'll probably need different things, or maybe my equipment, as I mentioned, expired. These are just some of the things that we have to focus on because we are not prepared. And this is why it's important for nurses to not work in silos, but to really work together, not just within our communities, but with our other partners as well. I mentioned the One Health approach, and this is not new. This is actually something that's been going on for more than a century. And really, it's this concept that has to do with the interdependence of all of these things within the ecosystem. So there's a couple of different graphics that explain it, but it's that shared environment that we had. It's that food and safety system, and then the medications as well. So as I mentioned, if that train derailment that I showed initially, if the chemical that was released, which has it's butyl nitrate, which has to do with a form of making plastic, if that seeped into the soil or seeped into the water system, as I mentioned, is that eventually going to come back to me and impact me and others in my community? Do I have a plan on what that looks like if it did happen? Where would I get my water source from? So these are just some things that we need to be cognizant of as we think of the disasters that are happening in our neighborhoods every day. The other thing that I want to stress is just that picture again of the mosquito-borne illnesses, and really because this is something that we are preparing a lot for now, whether it's dengue, whether it's Zika, whether it's encephalitis. Again, this is just something, I'm not sure if Sister Noor has this issue in Malaysia, but we here in the United States, due to migration, have this massive influx of mosquitoes that are coming, and we really don't know what they're bringing with them. I mentioned social media not being the best place to get information for news, but I do want to talk a little bit about other ways to get information, and that's that cultural reflections through film. So these are just some examples of some movies of that talk about types of disasters. And one of the few things that I do want to stress is that each one of these are just a depiction of that type of disaster, whether it's the Fukushima nuclear power plant or the tsunami that happened, or whether it's the worst industrial accident in history in Bhopal, India. I do want to stress that there's other things that we here in the United States have, and that is, again, that trafficking, whether it's human trafficking for sex, work, etc., or whether it's terrorism, and that really is the 4 hours on the Capitol. It's a great movie of what happened, the insurrection on January 6th here in Washington, D.C. So these are just some movies that I encourage, and there's plenty more. I'm not endorsing any of these, but I just thought that they did a great depiction of what it was like during that time for that disaster. So some global takeaways. I want to again stress that we can't work in silos, that interoperability is extremely important. Understanding what the gaps are and identifying mitigation strategies. There is a difference between cultural humility and cultural competence, and we have to respect the individual where they are, regardless of whether we are working out of a shelter or in a makeshift auditorium or a stadium providing care. We have to respect the individuals because, again, they're not going to trust us if we don't earn that trust. As mentioned, psychological first aid should be integrated right in the beginning, because if not, not only for the first responders and those that are being impacted, then we're not going to have a good outcome. Our care is going to be jeopardized. And last but not least, I do want you all to connect. So that is a QR code that has all of the blogs that I write on disasters. It's a great way to connect with me as well. And it's a great place to get access to evidence-based literature, as well as other resource tools as it pertains to topics of disasters and the role of nursing here in the United States and internationally. So I want to thank you for your time. And on that note, I will turn it back over to you, Val. Thank you.
Thank you so much, Jamla. That was a phenomenal presentation. I actually learned quite a bit about it, about information from your presentation. I'd now like to hand the microphone over to Nurul'Ain, and you can access your presentation. Thank you. Nur, I'm not sure if you're speaking or not, but we can't hear you.
No, not that.
Oh.
I'm just started
Oh.
with the slide. Sorry. Okay, good morning, good evening, good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh. Okay, I'm Nurul'Ain from International Islamic University, Malaysia. So my focus today is all about Malaysian nurses, from code red to code ready, whether we are prepared to any disaster that could happen in Malaysia. Okay, for those who are not really know where is Malaysia, here we are, and this is our flags. If looking in a glance, it looks like a United States flag, but we do have a moon and stars in our only one star. Okay, in our flags. So before I start with my introduction. So allow me to not explain, but briefly tell you about the Pacific Ring of Fire. Because here is Malaysia, because quite recent, for those who specialize in disaster, so I believe you read about sorry, I believe I didn't switch on my camera, right? Okay. Pardon me for didn't switch on the video, the camera. Okay, this is basically the Pacific Ring of Fire. If you interested with disaster, then you know this is where the Kamchatka earthquake happened in Russia, quite recent, and it affect those countries surrounding the Pacific Ocean, including United States on the southeast. No, sorry, not southeast. The west. So yeah, the west, and also in Japan. So this is why I can say that Malaysia is quite lucky in terms of having the earthquake and the tsunami. But bear in mind that back in 2004, when the earthquake happened and followed by tsunami in the north of Indonesia, a part of northern region of Malaysia is also affected. Okay, so basically that we can declare that we are not really safe from any earthquake or tsunamis. Okay, this is about the disaster landscape in Malaysia. What we usually receive or disasters that happen in Malaysia mainly floods, landslides, haze, occasional storms, and also tropical cyclones. But it's not as frequent as floods and landslide. Okay, these are the disasters that commonly happen in Malaysia. Okay, this is about the disaster management structure in Malaysia. Actually, back in 1991, where the Bright Sparklers firework factory, uh, it was like an explosion. In 1991, it kills about 26 people, mainly the workers that work in the factory, and followed by 1993 collapse of the condominium tower in the in Kuala Lumpur, and following few others disasters, the Malaysian government started to have this directive number 20, Majlis Keselamatan Negara, or we call it National Security Council, focusing on how to manage disasters under this National Security Council. Back in 1997, they started to have this to guide the Malaysian government, especially different agencies, to respond during disasters. And in 2019, the establishment of National Disaster Management Agency in Malaysia, 2015, and it superseded the directive number 20 of National Security Council, and it becomes ATMA Directive Number 1, which outlines the updated guidelines and mechanism of disaster management coordination and response at all levels and involve different agencies. Okay, and it outlines the multi-agency coordination across national, state, and district level, including Ministry of Health, Police Department, Military, Fire and Rescue Department, Civil Defense, and also community health teams, including nurses. Okay, these are the difference between Majlis Keselamatan Negara or National Security Council Directive Number 20, issued by OD itself, National Security Council, and the focus broadly on the national security disaster. And it's still referenced but superseded in some areas. And now we do have NATMA Directive Number 1, clearer scope on disaster responsible and coordination mechanism between interagencies, and currently used as a guiding to national and state response in disaster management. Okay, these are basically the level of um, disaster level in Malaysia. So level 1, it started with district area, and the chairperson will be district officers, and the function is the local municipality, and resources and mobilization, evacuation is only managed by the district level. And when it become involvement of state, so the response planning and coordination at state checked by the State Secretary and the Chief Minister, and so on with the national level. So the policy and the national coordination and the check by the situation checked by the Deputy Prime Minister. So these are the key supporting agencies in Malaysia. Mainly, Ministry of Health, they are champion on medical response, evacuation, public health surveillance, while the Royal Police, Malaysia Police, they are focusing on the security enforcement, traffic control, while Malaysian Armed Forces, they are focusing on logistic, transport, field hospitals, for fire and rescue department, or we call it bomber, is focusing on fire safety. And also, other than this agency, we do have also Malaysian Civil Defence Forces, which are focusing on the first aid, community evacuation, disaster drills, and also meteorological department Malaysia, forecasting an early warning system of any disasters that might happen in Malaysia. So basically, the solution for these key supporting agencies is to establish the interagency training, because these are the agencies that prominent in disaster management. So they have this interagency training and communication protocols, and it quite frequent they organize this interagency training. So they integrate the community-based early response system. They do disaster drill. They do at state level. They do at national level. So they also enhance the resource sharing and technological capability, because working in silo will limit you from knowing other people, what are their roles. So that's why it is important for nurses, especially those who have an interest in disaster, to involve in this interagency training. So then we know what our role during disaster, and also we know other agencies' roles to help us to coordinate and communicate during disaster. Okay, now we look into what are nurses' roles during disaster. Mainly, I believe this is not only applicable in Malaysia, but all over the world, because nurses, we know that we are the majority workforce in Ministry of Health or Health Services. So nurses are mainly the frontline responders during disaster. And in Malaysia, they are mobilized through Ministry of Health protocols and hospital-based disaster team. Their role spans from clinical in the hospitals to community level intervention across disaster phase. Okay? They become the clinical care providers. They also become the educators, coordinators, and advocates during disaster. Help all those people, not only in the hospitals, to organize the victims that will be sent to hospitals, but they also involved in managing people at the disaster site in the community. And also being a nurse, we are also psychosocially become supporter to our victim. Okay, what about our roles during preparedness? So we in Malaysia, I believe that nurses develop some nurses involved in developing disaster plan in the hospitals, in the community clinics, the health centers, conducting community education. They lead the disaster drill, and they also advocate for vulnerable population. And in fact, I believe there are many research studies done now that contribute to the readiness to make sure that effective disaster response, not only among nurses, but among healthcare providers. Okay, they become a planner for the disaster plan, educate the people, the nurses, not only nurses, but also those who work with them. Okay, they also involve as a trainer and facilitators for disaster drills, and some of them are being a researcher, conduct the studies about disaster response, disaster knowledge, KAP, knowledge, attitude, practice, how the nurses perform during disaster, and Malaysian nurses also not only just a caregiver in the hospitals or in the health center, but we also become a disaster responders. We are also become the educator and the mental health supporters, as mentioned earlier by Jamla. She mentioned about the psychological first aid support, and also we stabilize the system stabilizes during crisis. The diversities and the adaptive roles make we are an essential asset for national and local disaster response. But some of us, even nurses ourselves, don't realize that we are important to our disaster management team. Okay, because we be a part of healthcare services, be a part of Ministry of Health. Okay, so we are supporting each other. Okay, where are we actually in Malaysia? Because we are frequently affected by floods. Because for those who from Malaysia, they know that flood is quite like a festive season for, especially for those who live in the East Coast region. It's towards the end of the year, it become like a festive season. Those kids especially, they are uh, not really scared about the water rising. They actually waiting for the water to waiting for the flood to play with the water, and which we believe that it is not safe for them. It's quite hazardous for them. But yeah, being a kid, some of them not realize the hazard, the harm that can happen to them, right? Okay, disaster become more complex, quite frequent, and the most important, we do need the community response, community centered intervention, and now nurses not only focusing on victims in the hospital, but we do have the community. We need to strengthen our community to become resilient. Not only the victims, but we ourselves need to be resilient because of the changes of the landscape, disaster landscape in Malaysia. And in fact, we are the backbone of the healthcare, and so we are essential to the disaster responders. However, the question is, are we ready, or are we still need intervention, or we still need to learn more from other countries? Okay, so where are we now? Actually, to be honest, when we look into the pandemic that happened back in 2020, 2021, we are quite strong in our disaster response. However, we are quite less prepared in terms of planning during disaster. Okay, Malaysian nurses visible during crisis COVID-19, 2014, 2021 floods, and also dengue outbreaks. However, it's just like a one-off intervention. There's no continuity from the preparedness of our nurses. And many of us are deployed under Ministry of Health, hospital emergency response team for trauma care, for triage, and evacuation center support. But do we actually prepare our nurses? Because mainly those who receive the training are those who working in emergency department, mainly especially in the hospital where there are emergency physician, so they have quite numbers of training. However, not in the hospital where for example, like in rural areas, so they are quite underprivileged to receive this kind of training, and we believe that we are more reactive rather than proactive. Supposedly, we are the one who can initiate, who can propose to the department or to the hospital how we want to be prepared with any disaster that happen. Because we should learn from, although it's COVID-19 is a pandemic, but actually we should learn how we have to be prepared, how not only for pandemic but also for floods, for example, because we know that floods usually happen, landslides, also following the floods or following the heavy rains, torrential rain, and then mainly we experience landslide. Okay. Okay, what are the current strengths among our Malaysian nurses? We are quite responsive workforce during emergency. We are really put our self into the disasters management team. It's not 100%. It's like 150%. We put ourselves to work to help our victims during emergency and also disaster. And we also, when pandemic experience 2021, we also part of MOH disaster team. We put effort on vaccination campaign for our citizen, our community. We set up the quarantine centers and also the field hospitals. So, and currently, many of the hospitals, they are started to introduce a community-based disaster risk management and disaster resilience, and there are involvement of nurses in that initiative. Okay, now we look into some of the gaps that we believe it's happened among Malaysian nurses. We have we train nurses in disaster nursing. However, lack of institutional, which are from nursing school, nursing college, or university, combining the disaster nursing as a part of emergency nursing, as a part of community health nursing, public health nursing. So it become like inexistent of the disaster nursing specialty themselves. Okay? And also the certification of disaster nursing uh, competency, the national competency framework in Malaysia is not really following the disaster nursing framework. Okay, and also we have limited structured education on disaster nursing. So since 2012, in RIUM, in the university where I work currently, I start introduce elective of disaster nursing to the final year students to expose them with what nurses can do during disaster. Okay, and also involvement of nurses in policy engagement at the national disaster planning also not as much as we can proud of, but hopefully one day we will have many of nurses who have an interest in disaster nursing to be part of the policy makers in disaster national disaster planning. So we do have also unequal training between urban and rural, as I mentioned earlier. If let's say the hospitals are led by emergency physician who have the interest in disaster, then you can have a lot of experience with disaster drill. So, okay, now I believe it is a call for action for us to train more nurses. Although we have a lack of, or we have shortened of numbers of nurses in Malaysia, but I believe as I once wrote an article about every nurse should be a disaster nurse because disaster happen to everyone. Okay, everyone can affected by disaster, regardless of whether you are working as a pediatric nurse, you working as intensive care nurses, you work as for example, like renal dialysis nurse. What happened during disaster? So what should you do? What can you help your patient? Okay, gerontology nurse. So what is your role, or what are your roles to help those with geriatric patients staying alone at their home? So this is I believe is a call for action to build a generation of nurses that ready, disaster ready, and not just disaster reactive. And I believe that collaboration is a key from ministries to universities to local communities to educate people, because being a nurse is, you are not only educator but you are also advocator. So we have to have a multi-sectors collaboration. We have to have like multidisciplinary collaboration in responding to disasters and in how we want to manage our special population in during disaster. So instead of asking where are our nurses in the disaster, we should say that our nurses lead in disaster resilience. So that's why I believe that this is saying that we are actually ready, but we need more training and more involvement in policy making. So Malaysian nurses have proven, especially during pandemic, during COVID-19, we have proven that we are capable, we are committed, and being present is no longer enough. We have to make sure that we are prepared, and by preparations, we have to invest in education to train nurses, especially pre-services, especially when they enroll during our nursing school. So teach them how to recognize disaster nursing as a subspecialty, embrace the innovation, and also we can transform our nurses from responders to the resilient leaders in disaster risk reduction and health system resilience. I think that's all from me. The take-home message: preparedness is just not a policy, it is mindset. Malaysian nurses must equip not only to save lives during disaster, but to lead, to plan and protect before it strikes. So we are no longer reactive, but proactive towards what should be done during disaster. Don't let disaster happen, then from there we want to learn. We should learn before disaster happen, and we should know what should we do before disaster happens. Okay, before I end, next year I'll be organizing the 9th International Research Conference of World Society of Disaster Nursing in Kuching, Sarawak. Okay, so for those who have an interest in disaster nursing, World Society of Disaster Nursing will be organizing this conference next year. Okay, that's all from me. Thank you. These are my information. If you interested to connect, then you can email me, you can WhatsApp me. There is the WhatsApp number from me. Okay, that's all. Thank you so much.
Terima kasih, Nurul'Ain.
Thank you,
Thank you
Valerie.
very much.
Sama-sama.
That was a wonderful presentation. Very much appreciated. I'm going to open the floor for questions. Please use the Q&A button at the bottom. We do have 2 questions right now, which I will open to both Jamla and Nurul'Ain. The first one is from Annette Newman, who said, I've noticed that disaster preparedness and response is often missing from nursing school curricula, and to my knowledge is not included in NCLEX board exams, even today. Given the increasing frequency and complexity of disasters, how can we advocate for the inclusion of disaster training in both nursing education and licensure exams? Additionally, what are your suggestions for implementing ongoing, perhaps even annual disaster education requirements for practicing nurses? Who would like to take this question?
Is Jamla around? Okay.
I'm
If
not sure.
no, then I
Oh,
can give my answer part of it, and maybe Jamla can add on it. Okay.
sure.
Yeah, I do agree that disaster preparedness, disaster management, lacking in our nursing school, because I do access to them. I ask question to the ChatGPT, and the answer given was the school that in Malaysia, I talk about Malaysian setting. In Malaysia, only my institution, my university, and the other university, which is also government, how to say, public university, only two of us have this kind of like I mentioned earlier, me myself introduced elective for disaster nursing since back in 2012, which we already like about 13 years in the but I believe only in IUM they have this elective disaster nursing, and in fact for undergraduate where disaster been taught a part of emergency nursing. It's just like a 2 hours teaching, and I believe we need more because we know that the frequency of disasters happen in worldwide, not only in Malaysia, in worldwide is quite frequent, and we don't want, especially during pandemic, those who not prepared, they they become the victims. They die because of the lacking of preparedness. So I believe this is the time, as I mentioned, is call for action for us to implement disaster nursing, and in fact to um, to to realize that disaster nursing as a part of a specialty in other like emergency nursing, like geriatric nursing. So we have to make disaster nursing as a part of specialty in our nursing profession. I think that's all from me.
Thank you, Nur. The next question comes from Elizabeth Cookson Butler, and her question is, are there any countries that provide undergraduate nurses with disaster management education to prepare their nurses for disasters that may occur and cover community and hospital environments? So I'm
Any
gonna
other country?
from the Canadian
Oh, you,
perspective.
Valerie, in Canada.
I'm not aware that it's part of the undergraduate curriculum in nursing specifically, but there are undergraduate programs in disaster management that are non-nursing specific, at least in Canada. Noor, did you want to speak about Malaysia?
Yeah, as I mentioned, we are lacking in exposing our students with undergraduate students with disaster nursing. Only like out of, for example, this year I have about 10 nursing students enroll for my elective disaster nursing, as compared to the whole students about 105 or 6. So out of 105 or 6 too, only 10 of them learn I mean focusing more on disaster nursing, whereas for me myself, I believe disaster nursing should be taught to all nurses, I mean student nurses. So when they join the services, some of them not even have time to attend the drill or any simulation about disasters. And yeah, because like as when you start working, there's a competitive between you and other nurses to join the disaster training. So that's why I believe disaster nursing subject or courses should be taught during the undergraduate study.
Thank you. And our final question comes from Mohammed Ahmed Abdallah. What are the roles of nurses at the pre-hospital level and at the disaster scene?
Mm. Actually, it's quite difficult for me to answer this question because in Malaysia, pre-hospital level are mainly manned by assistant medical officers, and nurses only help if, let's say, we need backup for the team. So then it comes nurses to help. But for pre-hospital, like for example, like the first team usually consists of assistant medical officer. So I'm not sure how to answer your question, Mr. Muhammad. perhaps Jamla can answer on that,
I
because
see
I
Jamla's
believe
hand up. Go ahead, Jamla.
yeah, Jamla, please help me on
Absolutely.
this.
Sure. Thank you for the opportunity. Assalamu alaikum, Muhammad. So to answer your question, here in the United States, even though I am a nurse, I cannot work on an ambulance without having some sort of certification. And so the basic certification level is an EMT. Then you can be a critical care paramedic or a paramedic or a nationally registered paramedic. There are some community paramedicine programs, and that is where there is a shortage of clinicians, and they allow the paramedics to do more than within their scope of practice. And that's a great opportunity for individuals in rural areas to get the care that they need. I was a paramedic. I am a paramedic still, and obviously a nurse. And so when I worked on an ambulance agency, or on an ambulance, excuse me, I had the opportunity to work above my scope of practice. And then when I was a flight nurse and a flight medic, again, I worked above my scope of practice because we had a medical control physician who then allowed us to do certain things. So it depends on where you are. I do see that in Milwaukee, they have that program. Each state is different as well. So it's hard to answer specifically. I'm from New York, and that's what I did. But again, that's not the same for every community. So I'm sorry we can't give you a different answer, but that is the best depending on where you are.
Thank you so much, Jamla. And I just want to bring attention to the poster that I've just uploaded to let everyone know that WADEM is hosting our next Congress. It's the 24th Congress on Disaster and Emergency Medicine. And our wonderful friends from France are going to be hosting this in 2027 from the 26th to the 30th of April in Paris. And the theme of the Congress is Research, Relevance, and Resilience, enhancing performance in disaster and emergency medicine for communities, responders, and ecosystems. I'd like to thank everyone for participating today. It was a wonderful presentation. If there's any questions, please feel free to contact WADEM through email or through social media. And we look forward to our next Nursing Special Interest Group webinar. And I want to also thank our wonderful presenters, Jamla and Nurul'Ain, for their presentations. And I hope everyone has a wonderful day, afternoon, evening, or night. Thank you very much.
Okay, thank you, Valerie. Thank you, everyone.